There have been a lot of changes and a lot of new information this week coming from the government and the Saskatchewan Health Authority. CBC political affairs reporter Adam Hunter joins me now. Adam, more vaccine rollout, but also cases are increasing in Regina and so are the variants of concern.
Yeah, Sam, it seems to be changing by the hour, and I don't want to talk about what the vaccine rollout plan is specifically the drive-through in Regina, because we're getting updates fairly frequently. We know last night it expanded to everyone over the age of 60 to 69 for the drive-through. That's something that it started earlier this week, and it is response to the variants, as you mentioned. But yesterday, the government coming out and saying that they're happy with the uptake so far from residents in their 70s and 80s and up, who they say about 80% in each category have either been given a dose or signed up for a booking. I have some numbers for you. As of March 17th, persons over 80, 53% have received at least one dose, 14% have received both doses. People in their 70s, first dose, 19%, second dose, 5%. So relatively low, but the government's confident that with those early numbers about how many people are booking vaccinations, that those numbers will continue to grow. Saskatchewan has consistently been among the leaders in getting doses out once they get them, leading as of yesterday all provinces. And as you mentioned, Sam, the variants of concern, that's another thing that Saskatchewan has near the top of the list. Not as far as numbers, but per capita, it's not great. It's not great in Regina specifically. As you mentioned, Regina this week, 85-ish% of presumed cases, 90% of the confirmed cases. That was as of yesterday. Those could change over the next couple of days, but that gives you a sense of how prevalent the variants of concern are in Regina, and people need to remember that these are more transmissible and more dangerous, according to Dr. Shahab, and studies from other countries where they've seen variants spread more quickly and earlier than they did in Saskatchewan. I talked to an infectious disease expert doctor in Regina who said that they were surprised that Regina received these variants as quick as they did, because you'll know throughout the pandemic we've kind of lagged behind in when cases have gotten here, when hospitalizations have happened, but that's not been the case with variants.
Adam, we've heard from Premier Moe that the vaccinations are the way out of this pandemic, but at the same time, a lot of people still want to see more restrictions, especially as we get closer to Easter.
Yeah, this doctor I spoke to, Dr. Wong in Regina, he said that, the slowdown rather than a lockdown is something that's needed right now, specifically for Regina, because that will knock down the numbers of contacts that people have during the day, that will reduce the number of transmissions. He said it's a balance between making the right policy and protecting people from the virus, and that's what the government is weighing right now. When we asked about that this week on two occasions to the Premier and also the Health Minister on Thursday, they both said that they're going to wait and see another week, perhaps Tuesday when we have our next news conference with Premier Moe, about what any additional steps they'll be taking in Regina. But we know last week that bubbles were allowed to expand, that people were allowed to see friends and family up to 10 in indoors and outdoors, even with this variant spreading in the city. And that's something the government says they'll be looking at. They'll be monitoring the cases, monitoring hospitalizations. But as you mentioned, the predominant number of new cases in the province on a daily basis are coming from Regina, and they're being blamed on that variant. So a lot of different things in play. The NDP asking for rapid testing in schools, as we've seen a tick up in school cases, and we know that there's been variants reported in schools in different parts of the province, which have caused them to go online. So a lot up in the air right now, but many of the experts calling for that slowdown, not a lockdown, but a way to reduce people's contacts in their day so that they're not transmitting the virus, either symptomatic or not symptomatic. And again, stressing that people should get tested, and stressing that those are eligible for the vaccine, whether they be over 67 who can call in, or those over 60 that are in Regina can get the drive-through, that they do so as soon as possible.
A lot to watch for next week. Adam, thanks so much for this.
You're welcome.
Adam Hunter is our political affairs reporter. He joined us in Regina tonight.